Hello, this is Dr. Hamo, and the case of today is a peripheral case. This is an elderly patient with significant disease in the brachiocephalic trunk. Patient had discrepancy in the blood pressure readings and weak pulse in the right radial, and you see here is severe tight calcified lesion in the trunk, and we have another lesion there in the proximal segment of the subclavian just after the rima. There's the angiogram again. This is a 6 French GR4, and here is different view. This lesion and that lesion too. So here started the case with 7 French long sheath, 7 French sheath, and this is still the 6 French guide, and I advanced the run-through as you see here, and then I'm gonna start with short 4-0 shockwave. This is the lesion again, and here is 4-0 shockwave. After shockwave, I did 5-0 NC balloon, 5-0-15. Here is we pull in the balloon and advancing over the balloon, the guide again. Here we're gonna measure the length of the lesion, so we're gonna place the stent just before the takeoff of the carotid up to the proximal segment. And to do that, I need better support, so I have to have the 60 centimeter 7 French sheath, so I advance it up to the osseal segment. This is a longer 7 French sheath. Now to do that, you need better support than run through. So we have a 7 French guide. Now we're gonna exchange over the glide fine catheter from run through toward longer J wire. Yet stent did not pass through, so I have to do another dilation using 7-0 millimeter balloon. This is the drug coated balloon, which was inflated for the nominate and also for the subclavian. And here is advancing a 9-0 x 25 millimeter stent. So the length of the stent is not always available what you ask for, so 925 was very appropriate for this case to land it before the carotid. And here the inflation of the stent. Here I advanced the guide distal to see the subclavian before we pull, and the subclavian looks good with nice flow. And here's the final angiogram. We have nice coverage of the lesion and did not compromise the carotid artery. And here is different view as well. All right, thank you for watching.